I'm Matthew Luby. I'm a student nurse here at South Alabama today, and I'm here to do a medication administration checkoff today. So I'm making sure I'm in a distraction-free zone, free from any coworkers, no phones, so I'm able to get this procedure done in an orderly fashion. So first I'm going to take my patient care order form, as well as my MAR, so these two. So I see I have Jaguar J. Jones, medical record number 4176352. 4176352. See, is allergic to penicillin, and I see I'm administering heparin today. So it's going to be 5,000 units, subcutaneous, every 12 hours, and this is an anticoagulant to prevent him from having blood clots. And all elements of a legal prescription are included. I'm going to take my MAR, set that aside. All right. I'm going to perform hand hygiene. So I'm going to just look at my MAR one more time to see. So you have patient's name, Jaguar J. Jones, medical record number 4176352. He is allergic to penicillin. We're not administering that today. We are administering heparin. So this is the one we're using. I see it is 10,000 units, and we're administering 5,000 units. So this will be a half milliliter of heparin every 12 hours. I see he has not had this in the past 12 hours, so we're going to be administering this for his blood clots, as it's an anticoagulant, and all legal elements of legal prescription are included. And before I administer this, I'm going to make sure with another nurse that that the dosage is right, the calculation is right. So now I'm going to pick up my syringe. Since this is a subcutaneous injection, we have a TB needle. Alright. I'll open this and butterfly method. Prevent not me touching any sterile part. Pull this out. My heparin over here and my needle. So again, I have 5,000 units. This vial contains 10,000. So in here, I'm going to take the cap off. So first, before I would clean the vial, so act like I'm just gonna open this up. Clean the vial around for 15 seconds. All right, 15 seconds. And like I said, half a milliliter. So first I'm going to inject half a milliliter of air, prevent any air bubbles. All right, so we have half a milliliter. All right, since I already cleaned it, pull back this safety. I'm gonna inject my air into the, alright. And then pull it slowly, prevent any air bubbles. Up for a half a milliliter. Alright. Put that down, recap. I don't have to, I just have to put the safety on since it has a safety. On the recap, you see I have half a milliliter. I will check with this with another nurse, making sure again. So this was heparin in my syringe. We have 5,000 units. This is half a milliliter. It's going to be every 12 hours. He has not received it in 12 hours. And this is for an anticoagulant to prevent blood clots and all elements of legal prescription. This is again for Jaguar J. Jones. So now I'm going to grab a piece of tape. On this piece of tape, I am going to put it on my syringe, but first I have to put some information. So we have Jaguar J. Jones. We have heparin. This is 5,000 units, or half a milliliter. And I'll put my initial, which is ML. We have that. Now I'm going to place this on my syringe. Just check before I go into the room. So I'm administering Jaguar J. Jones, and I see I'm administering heparin today, 5,000 units, which is half a milliliter, subcutaneous, so I have my TB needle. This is every 12 hours. He has not received it in the past 12 hours, so it's time to give him this medication, and to prevent blood clots and all elements of legal prescription. So now, grab my prescription, my MAR file, take it to the patient's room. Knock, knock, knock. Hand hygiene. How are you doing today, Mr. Jones? I'm doing good. So today, I'm going to be administering heparin today. But first, I have to just make sure you're the correct patient I'm administering. So you have Jaguar J. Jones. Medical record number 4176352. 4176352. See, you're allergic to penicillin today. Or you're allergic to penicillin. Are you allergic to anything else? No. So that's good. So like I said, I'm administering heparin today. So we have heparin, 5,000 units, which is half a milliliter in here, every 12 hours. You haven't received this in 12 hours yet, so I think it's time to administer it to you today. It's going to be a subcutaneous injection, so I'm administering in your abdominal area. And this is to prevent blood clots from you and all elements of legal prescription. So first, I'm going to perform hand hygiene on my goggles and my gloves. Then, once I have my gloves on, make sure the bed is higher to a working height for me. The bed rail is down. I'm gonna have Mr. Jones just lift up his shirt so I can administer it in his abdominal area. Before I administer, I will explain to him what I'm about to do. So, wrong way. So Mr. Jones is already laid down. So I'm just asking to raise his shirt. If he wasn't able to, I'll just do it myself. Just make sure the skin is free of bruising. And then I'm going to take my alcohol pad. Make sure to clean it from inside to out, making sure it's all clean. Like I said, Mr. Jones, I'm going to be administering in your abdominal area today. It's going to be 2 inches around your umbilical, making sure it does not go above your intercostal and not below your pubic, and it's going to be in between your anterior superior iliac spine. So now I'm going to take my syringe, Mr. Jones. It's going to be fast, so just be patient with me. So I'm going to pinch the skin, able to pinch 2 inches, so for a subcutaneous injection. This will be at a 90-degree angle. So 1, 2, 3. All right, now I'm going to slowly, all right, recap this, put it in. I'm gonna just hold that there. How you doing, Mr. Jones? So I'm gonna just stay here for 2 minutes, making sure he has no adverse reactions. Put this down, take off my glove, and throw that out. All right, I'm gonna lower the bed all the way, lower the side row, making sure there's only 3, and then, so put Mr. Jones right. All right, so now I'm gonna go document, see his, for first I would perform hand hygiene. Leave the room, go document, making sure if he was tolerant enough, the doses, the time, the route, all that on his MAR. Then I'll come back into the room in 15 minutes, or 15 and 30 minutes, making sure he has no allergic reaction. I see you have no allergic reaction, Mr. Jones. You're all good. I'll see you back in 12 hours to administer another one. That will be it.